Hey there, this is Dr. Linda Burke, board-certified OBGYN physician, blogger, and author of The Smart Mother's Guide to a Better Pregnancy. So today I want to talk about the tragedy of misinformation in terms of OB. There was a story circulating in the media for about a week about the daughter of a celebrity who ultimately had a neonatal death because of a shoulder dystocia and a cord compression. I believe that the delivery occurred at home. I'm not really sure. I'm not here to shame and blame this young woman. I am sure that she's experiencing a lot of pain, but I do want to talk about misconceptions. Specifically, there's no such thing as a low-risk pregnancy. Now, the reason I bring this up is because one of my colleagues is out there in the community marketing herself as someone who can do home births for low-risk pregnant women and pregnant women who desire vaginal birth after cesarean section. There's no such thing as a low-risk pregnancy. There are uncomplicated deliveries. You can have a completely benign prenatal course, no risk factors, go to the labor room because you're in labor and all hell breaks loose in the labor room. Why? Because your uterus is contracting, it's squeezing your baby. Sometimes the umbilical cord gets in the way, which means that the oxygen for the baby is diminished. And when the baby's brain does not receive enough oxygen, that can cause potential injury to the baby's organs that depend upon oxygen. So obstetrics is a specialty of the unexpected, okay? The other thing I want to talk briefly about is shoulder dystocia. It occurs in about 0.9% of pregnancies. We can round it up to 1%. We cannot predict who is going to have a shoulder dystocia or not. There are clues of who's going to have a shoulder dystocia, who might have a shoulder dystocia, let me put it that way. And that's if you have a big baby, if the baby weighs 10 pounds or more, then heads up. We have to be on alert about that. But there's no magic formula. However, women who have had a previous shoulder dystocia have an increased chance of a repeat episode of shoulder dystocia. The recurrence rate is 25%. And what will make that incidence occur at a greater proportion is if the second birth weight of your present pregnancy is greater than the birth weight of your first pregnancy. So in other words, if you're pregnant for the second time and the baby is estimated to weigh more weight than the first pregnancy, then your chances of having a repeat shoulder dystocia is increased. So these are why, this is why you have to be under the professional care. I'm just going to be real, of someone who knows what they're doing, okay? Pregnant women, I love y'all. I want the best for you. And so therefore, this is why I'm sharing this information. Thank you so much for listening. I hope if you got something helpful from this information, please share it on. And I look forward to seeing you again.